Quick disclaimer, information in this podcast is for general informational purposes only and is not intended to be treated as medical advice. Always consult with your healthcare team before making changes to your diet, lifestyle, supplementation, or medication.
Wondering what your A1c is really telling you? If it's too high, dangerous, normal, or if you need medication? Well, it's one of the most important numbers in pre- and T2 diabetes, so let's get down to the numbers and what they really mean for you.
Welcome to Type 2 Diabetes Talk, the place where we chat about what really works to treat type 2 diabetes and prediabetes naturally with nutrition and lifestyle. If you're looking to optimize blood sugar and A1c, lose weight, reduce medications, and improve your overall health, this is the place to be. Now, here's your host, Type 2 Diabetes Nutrition Specialist, Dr. Jetta.
Hello, wonderful people. Thanks for joining me today, where we're focusing on A1c levels and some common questions that come up around it. When it comes to A1c, you'll also hear it called hemoglobin A1c or HbA1c. They all mean the same thing. A1c is one of the most important numbers you'll ever come across if you're living with prediabetes or type 2 diabetes, and it's a test that doctors use all around the world. We're going to be covering what it measures, what's considered normal, what levels are too high, what the A1c numbers really mean for your health, and some common questions regarding A1c and medications. By the end, you'll have a clearer picture of how to understand your results and the number one thing to focus on to move those numbers in a downward direction. The first question we're answering today is, what does HbA1c measure? A1c is a blood test that measures how much sugar is attached to your red blood cells. Think of it like a long-term memory of your blood sugar. Every time sugar circulates in your bloodstream, some of it sticks to a protein in your red blood cells called hemoglobin. The more sugar in your blood, the more sticks. Red blood cells live for about 3 months, so the A1c test gives us an average of your blood sugar levels over the past 3 months approximately, not just as a single moment in time like a finger prick test does. A1c is a valuable marker because it shows your longer-term blood sugar trends and it helps you understand whether your nutrition plan, treatment strategies, or lifestyle changes are keeping your blood sugar in a healthy range. The results of an A1c test are often reported as a percentage, but they can also be reported in millimoles per mole, which is common in the UK. And that brings us to the next question. What is a normal A1c level? Before I share these numbers, I will just say they can be a little bit confusing because they are not the same all over the world. They should be, as it really doesn't make sense that they're not, but that's just the way it is. So in the US, a normal A1c is below 5.7%. In many other places like Canada, the UK and Australia, a normal A1c is considered below 6% or below 42 millimoles per mole. Once your A1c is in the range of 5.7 to 6.4% in the US, that's called prediabetes. In many other places, like Canada, the UK and Australia, you'll be diagnosed with prediabetes when A1c levels are 6.0 to 6.4% or 42 to 47. At 6.5% or 48 and higher, that indicates type 2 diabetes, and that is the same all over the world. Knowing your A1c level is important because it gives you a benchmark. It tells you not just where you are today, but where your blood sugar has been trending over the past few months. So the next question is, what is a high A1c level? Any number above normal is considered high, or at least higher than normal, right? An A1c of 6.5% or higher, which is 48, is considered high enough for a diagnosis of T2 diabetes. But the higher the number goes beyond that, the more concerning it becomes. For example, an A1c in the 8s or 9s means your average blood sugar is running well above normal, and that increases the risk of complications over time. To put it into context, an A1c of 7% or 53 is the level many diabetes guidelines use as a treatment target for T2 diabetes, or in other words, your medical doctor will likely be telling you to reduce your A1c levels to 7% or below. That's if you have type 2 diabetes. If your result is higher than that, it suggests your blood sugar has been elevated consistently and it needs more attention from nutrition changes or lifestyle strategies. So while 6.5% or 48 is the threshold for diabetes, anything above 7% or 53 is typically considered a high A1c that should be addressed more actively. But again, any level above normal is considered high, so you should be taking action to lower it. And that brings us to another important question. At what A1c level does damage start to happen in the body? Hearing about the negative consequences isn't fun, I know. But it's important to be informed and knowledgeable about the potential consequences because they are very real if they affect you. And knowing about them gives you the opportunity to take it seriously and be proactive. Back in episode 30, we spoke about how diabetes complications develop. You can listen to that whole podcast for an explanation, but briefly, when your blood sugar or A1c levels are tracking above the normal or recommended range for prolonged periods, this increases your risk of developing complications. And research shows us that damage can begin even before diabetes is officially diagnosed. Studies have found that people with A1c levels in the pre-diabetes range, between that 5.7 to 6.4% or 39 to 47, can already have early changes in their blood vessels, nerves and eyes. Once A1c reaches 6.5% or 48, the risk of complications can increase more significantly. The higher the A1c climbs above that, the greater the chance of long-term problems like heart disease, kidney disease, nerve damage, and vision loss. For example, risks start to rise sharply once A1c goes above 7% or 53. The important thing to remember is that the risk is not black and white. It increases gradually as A1c levels go up. And it emphasises the reason why lowering your A1c, even by a small amount, can make a real difference to your health and reduce the likelihood of complications down the track. The next question, and a serious one that comes up sometimes, is what A1c level is considered dangerous? The higher your A1c, the greater the risks. An A1c in the 9s or 10s, which is 75 to 86, is often considered dangerous because it reflects blood sugars running at levels that can cause both short-term symptoms and potentially long-term damage. At these levels, people may experience things like extreme thirst, frequent urination, fatigue, or changes in their vision. If A1c climbs even higher, into the double digits, the risks become more immediate. For example, an A1c of 12% or 108 means average blood sugars are around 300 milligrams per decilitre or 16 to 17 millimoles per litre every day. That puts enormous strain on blood vessels, the kidneys and the eyes, and it raises the chance of hospitalisation for things like severe infections or diabetic emergencies. I've seen people living with levels that high, even up to the 15s, and these levels are considered dangerous, quite simply because they put you at risk of damage to your blood vessels and the complications that arise as a consequence of that. High A1c levels do need to be taken seriously, okay? I know sometimes people are newly diagnosed and they don't know their levels have been up in the 9s. That's okay. Don't panic. Just take action now and you can bring these levels down. While we know an A1c of 6.5% or 48 is the starting point for diabetes, the real danger is when those numbers keep climbing or they remain unchecked for prolonged periods. And of course, the sooner you take action, the better. But one important thing to know is that lowering A1c by even 1 point, say from 10 down to 9 or 9 down to 8, makes a measurable difference in reducing complications and improving health outcomes. We've seen this demonstrated in research time and time again. So again, the important thing is don't panic, just get proactive. Every drop in A1c matters, and it's never too late to bring the numbers down. Get started now and work toward lower levels over time. We've seen people go from the 12s and 15s down to 6 and 7s and normal A1c levels again with nutrition and lifestyle alone. So we know this is possible, and research certainly shows us it is too. The body has an amazing capacity to heal and change when given the right environment. So no matter where your A1c levels are now, get started with lowering them through nutrition. And of course, if you need help to do that, head to our website for our programs and services. We can help you.
Don't spend months or years trying to work out how to treat your diabetes. With Dr. Jetta's VIP online membership, you'll have trusted support wherever you are at your fingertips whenever you need it. Access detailed guides to understand exactly what to eat. Explore the huge members library. Receive delicious weekly meal plans and join monthly member check-ins for personal feedback and accountability. Learn more and join as a VIP member today. Visit type2diabetestalk.com/programs.
The next question we'll answer is, what A1c level requires medication? This question comes up a lot, and in reality, there isn't one single number where medication suddenly becomes mandatory. Doctors often recommend medication once A1c is at or above 7% or 53, especially if nutrition and lifestyle changes haven't been tried or aren't bringing results. Some doctors may even suggest starting medication sooner if blood sugars are rising quickly. Other doctors are very quick to prescribe with any diagnosis, even if it's not really necessary. So here's the important point. An A1c level that's elevated doesn't automatically mean you need medication. In fact, for many people, nutrition changes and lifestyle adjustments are powerful enough to bring A1c down into a healthier range, even when their A1c levels are up in the 9s or 10s, especially when newly diagnosed. In fact, people often find that with the right approach, such as we teach people to do, following guidelines like lowering carbohydrate intake, eating balanced meals, increasing nutrition quality, being more active and focusing on sleep and stress, all of these things help them reduce or even avoid medications altogether. So many people ask a similar question, and that is, what A1c level requires metformin? Metformin's usually the first medication offered for T2 diabetes. Doctors often prescribe it once A1c crosses 6.5 to 7% or 48 to 53, sometimes even earlier if they believe blood sugars are heading upward. But again, this doesn't mean you have to take it, as it's often not necessary. Many people choose to make targeted nutrition and lifestyle changes first and see their A1c come down without ever needing to start metformin. Same with prediabetes. For most people, while medical doctors may move quickly to prescribe it because that's what they know how to do best, it doesn't mean it's needed. For prediabetes, medication is usually not necessary at all. Another question people often ask is, what A1c level requires insulin? From a medical doctor's perspective, insulin is usually considered when A1c levels are very high, often above 9% or 75, particularly if blood sugar is rising rapidly or if there are symptoms like excessive thirst, frequent urination, or unintended weight loss. So doctors can recommend insulin in those cases to bring blood sugars down quickly and prevent immediate risks. The thing is, though, overall, we don't really want people to go on insulin for various different reasons. Insulin use often comes with quite significant challenges like weight gain, low blood sugar episodes, worsening of insulin resistance, and increased dependency, which is why avoiding it is often a key goal. Insulin doesn't correct the underlying problems that your altered metabolism is experiencing, which is why nutrition and lifestyle changes remain the most effective long-term solution. Once insulin's started, it can sometimes be difficult to come off, but it is possible with the right nutrition and lifestyle strategies, the right support, and with the right mindset and commitment. So these are just a few of the factors to consider if insulin is offered as a potential strategy for you. It's certainly not the best or the first option that should be considered. But also, it's an important thing to mention because many people are able to reduce or come off insulin completely once they've made the right nutrition and lifestyle adjustments and with the right support. So don't leave that out of the question either. Before we move on to chat about how much medications can lower A1c, let's hear a testimonial from one of our members.
Joanne said, "You have been so much help to me this past year. My A1c started out around 9.5. It has been at 5.4 for the past 6 months. I have lost close to 50 pounds. Thanks for all your help."
Another frequently asked question is how much do medications reduce A1c? This is such an important and quite an interesting question that doesn't get answered a lot. And I looked at this extensively when I did my PhD because we want to measure medication reduction in clinical trials. We need to understand this and use a score to grade medication reduction. For metformin, taken at the maximum dosage, the maximum A1c reduction you'll see is 1.5%. For sulfonylureas like glipizide and gluburide, you'll see a maximum reduction in A1c of 1.5% at the maximum dosage. Now, just a quick sidebar here is that there was some recent research that indicated sulfonylureas might increase risk of cardiovascular events like heart attack and stroke, and I won't go into that here, but I'll leave a link to that info in the show notes on our website if you want to explore that more and you're taking this medication. For GLP-1s, the A1c reduction is around 1.4%, and for Mounjaro, at higher doses, it can be as much as 2.5% in people with A1c levels above 8%. For SGLT2 inhibitors, things like Farxiga and Jardiance, the maximum A1c reduction is 0.7%, which isn't very much, and the same goes for DPP-4s like sitagliptin and linagliptin. The maximum A1c reduction is just 0.7%. When it comes to medications, they can be helpful tools at times, but they don't have to be the first or only option. If your A1c is creeping up, it's a sign your body needs support, and there are proven natural strategies that can help before relying on prescriptions. We know from an abundance of research that nutrition and lifestyle is far more effective than any medication. So overall, it's worth pursuing natural strategies before medications. And if you're currently taking medications, you can certainly reduce and get off medications like we support our members to do. After more than a decade of helping people, it's clear eating to treat diabetes is the most effective treatment option. So wonderful, people, that wraps up our Q&A on A1c today. Of course, we haven't answered every question there is, so if you have a question yourself, head to our website at type2diabetestalk.com/message to leave a message or send an email. Here's what I want you to take away from today. No matter where your A1c numbers are now, they can come down, and nutrition is the most powerful tool you have to make that happen. We've helped people drop their A1c from double digits back into normal ranges simply by changing how they eat. We're helping our members every day to achieve better numbers, to reverse their prediabetes and type 2 diabetes, reduce and get off medications, as you can hear in previous episodes where members have shared their stories. And there are plenty of member stories and testimonials on our website as well. When you focus on the right foods, balance your meals, and make steady lifestyle shifts, taking small steps forward each and every day, you'll be amazed at what your body can do. You really will. And you don't have to do it alone. If you need more practical guidance and support lowering your A1c naturally, please do visit our website. That's where you'll find step-by-step programs, proven strategies, real support. What I do know is that you don't want to wait for things to get worse. The choice is yours. That's all for today. Dr. Jetta, over and out.
Thanks for tuning in to Type 2 Diabetes Talk. Please subscribe to the show on your favorite podcast platform. And for episode replays, episode notes, and more, visit type2diabetestalk.com. New episodes are available Tuesdays, 10 a.m. US Eastern Time, or your time zone equivalent. Thanks again. We're truly grateful to be a part of your life and help make a real difference.